Hello, in this section I will talk about Mapleson system. Mapleson system, which is a breathing system. So what do I mean by breathing system? Breathing system is a connection between anesthesia machine and patient. What is the work of breathing system? The work is to bring the inspiratory gas towards the patient from machine and to remove the expiratory gas away from the patient. Now, there are two important breathing systems which we need to discuss. One is the Mapleson system, which I will discuss in this section, and the other would be the circle system, which I will discuss in the next section. So, let us talk about Mapleson system. Now, Mapleson system, which constitute of 6 circuits, A, B, C, D, E, F. It is a system which is classified by Mapleson, but not any of these circuits were designed by Mapleson. He did a functional analysis of these circuits and classified them under one system, that is Mapleson system. Now, what is the common feature of these circuits? Now, these circuits, they are miscellaneous circuit which was designed by some early pioneers, and they all had a common feature, that was to and fro movement of inspiratory and expiratory gas in the circuit. So, there was to and fro movement of inspiratory and expiratory gases within the circuit. This was the common thing in the circuit. And another very important feature of Mapleson system was that CO2 elimination was dependent upon the influx of the fresh gas flow. So, CO2 removal from the circuit was by the flushing action of fresh gas flow. If you see the circle system, the carbon dioxide removal is dependent upon CO2 absorber. But in Mapleson system, it was dependent upon the flushing action of fresh gas flow. If you see the circle system, in that the gas moves in a circle, the inspiratory and expiratory gas, they move in a circle, they do not mix with each other. And in Mapleson circuit, there was a to and fro movement of the gases, right? So, mixing of the gases was very easily happening, and CO2 removal was dependent upon the flush by fresh gas flow. Now, I told you there are 6 circuits, A, B, C, D, E, F. I would talk about these circuits, and I would tell in some circuit that this is the best circuit for spontaneous ventilation, this is the best circuit for controlled ventilation. Now, how is this best decided? This is decided by only one factor, and that is how efficient is the circuit for that type of ventilation. Now, how is the efficiency decided? Efficiency is decided by the requirement of fresh gas flow to remove the carbon dioxide from the circuit. Well, if a particular circuit needs a lesser fresh gas flow from anesthesia machine for CO2 removal from the circuit, then it is more efficient and more economical circuit for that type of ventilation. So, it's best for that type of ventilation. And if a circuit requires same less fresh gas flow for CO2 removal for controlled ventilation, then it is most efficient for that type. For controlled ventilation, it is best circuit for controlled ventilation. So, efficiency decide which circuit is best for what type of ventilation, and efficiency dependent upon the requirement of fresh gas flow to remove the carbon dioxide. If a lesser fresh gas flow is required to remove the carbon dioxide, we would like to use that because it will be more economical to use less fresh gas flow to do the job. The job is to remove the carbon dioxide. Okay. Now, so this Mapleson circuit, when was it classified? Well, it was classified in 1954 by Mapleson in 5 circuits, A to E. And later on in 75, Willis added the 6th circuit, that is F. And then it became the modified Mapleson system. So, in 1954, Mapleson classified these system in A to E, and in 1975 Willis added Mapleson F to it, and now it became A to F. So, the system which I will talk to about you is Mapleson system A to F, and now we call it modified Mapleson system. So, modified Mapleson system is what we will talk, modified Mapleson system. Okay. Now, what is the similarity in all the circuit which comes under modified Mapleson system? Now, all these circuit have same components. The parts of the circuit are same. Only the arrangement of one part from another is changed, and different type of circuit comes into existence. So, what I'm trying to tell you, that all circuits of modified Mapleson system have similar component, but assembled in different sequence in order to make them more efficient for special circumstances. Okay, like spontaneous ventilation, controlled ventilation, etc. So, what are the parts of Mapleson circuit? What are the components of Mapleson circuit? So, coming on the components of Mapleson circuit. So, with the image we will discuss. So, these are the 6 Mapleson circuit: Mapleson A, B, C, D, E and F. Now, let us see Mapleson A first. Mapleson A. What are the parts? Now, this is the first part. It is arranged fresh gas flow inlet. So, fresh gas flow inlet, this is the first part of the Mapleson A circuit. This is also called the anesthesia machine end of the circuit. Then you see, this is the reservoir bag made up of rubber or neoprene. This bag expands when the gas fills it. It acts as a reservoir bag in spontaneous ventilation and is used for creating positive pressure for positive pressure ventilation. So this is the, let's say, second part. The third part, the corrugated tube, the corrugated breathing tube, which acts as inspiratory and expiratory limb. Then the next part, APL valve, adjustable pressure limiting valve. That is a spring loaded valve which is used for expiration, removal of the expiratory gas from the circuit and to create a pressure in the circuit. And this is the patient's end. Okay. So what are the different parts, components I told you? Number 1 was the fresh gas inlet. Fresh gas inlet, or we also call it machine end. Whatever gas which enters from machine into the circuit, from the outlet of machine where the circuit is attached into the circuit, that is called fresh gas, right? So that is the first part. The second part, as I told you, the reservoir bag. Reservoir bag. Third part, the corrugated breathing tube. Corrugated breathing tube. The fourth part, the adjustable pressure limiting valve. Adjustable pressure limiting valve. And fifth is your patient end, the end which is attached to the patient. So, machine end, patient end. This is the two end of the circuit. So, if I show you, this is your anesthesia machine, this is your patient, right? And this is the airway of the patient. We connect the circuit between the outlet of the machine to the patient's airway. Okay. So, one part definitely has to be the fresh gas end, that is the machine's end, and the other part has to be the patient's end, because this is the two connection. And what is the work of machine? Work of circuit to bring the inspiratory gas and to remove the expiratory gas. Remove the expiratory gas. What do I mean by remove the expiratory gas? Remove the carbon dioxide from the expiratory gas. Okay. And in Mapleson circuit, it depends upon the influx of the fresh gas flow for removal of carbon dioxide. And all the Mapleson circuit has the following component. Now, as I just now told you, all circuit have same component. Thus, the rearrangement of component is done in a different way and different circuit comes into existence. So, let me show you something. Now, let's say we are arranging all the parts of the circuit on the corrugated breathing tube. And let me give a numeric number to all the rest of the part. So, fresh gas inlet, let's say I am telling it is 1. Reservoir bag, it is 2. Adjustable pressure limiting valve is 3 and patient end is 4. Now, how is this 1, 2, 3 and 4 arranged over corrugated breathing tube in Mapleson A circuit? So, in Mapleson A, we have the fresh gas inlet first, then we have the breathing reservoir bag, and then we have the adjustable pressure limiting valve, and then we have the patient end. So, it is 1, 2, 3, 4 how it is arranged. Now, if I rearrange it, if I bring the 2, that is your reservoir bag as the first part, then APL valve as the second part over the corrugated tubing, and then the fresh gas inlet, and then the patient end, it becomes Mapleson D. So now the working pattern efficiency of this rearrangement in the form of Mapleson D would change from Mapleson A. So parts are still the same, only it has been arranged in a different way, and now the circuit's efficiency changes for different circumstances. Like A is best for spontaneous ventilation, D becomes more better and best for controlled ventilation. Right? So parts are same, only the arrangement is changed and of one part over other. Now, how did Mapleson decide that he has to name A as A, B as B, and C as E? What was the pattern of cataloging them from A to F? Now, this he catalogued on one basis, on the basis of the requirement of fresh gas flow in these circuit to flush out carbon dioxide in spontaneously ventilating person. So, in increasing order of the requirement of fresh gas flow for CO2 removal in spontaneous ventilation, he catalogued the different circuit in A, B, C, D, E, F. So, A would require the least fresh gas flow for spontaneous ventilation, then B, C, D, E and F, like that. Okay. So, what I am trying to tell you that Mapleson catalogued in order A to E and later on F on the basis of increased requirement of fresh gas flow, increased requirement of fresh gas flow to prevent rebreathing, during spontaneous ventilation, right? So, he did it during spontaneous ventilation. So, A, B, C, D, E, F. A requires fresh gas flow of 0.8 to 1 times minute ventilation of the patient. MV stands for minute ventilation, right, of patient for CO2 removal. B and C requires fresh gas flow equal to 1.5 to 2 times minute ventilation for CO2 removal in a spontaneous ventilating person. And your DEF, they require fresh gas flow 2 to 3 times the minute ventilation. So, they were catalogued in an increasing order of requirement of fresh gas flow for spontaneous ventilation. Got my point? Okay. So, Mapleson classified them in ABCD on this basis. So, it was the 6 circuits. Before moving on how we will classify them and how we will discuss them, how we will do the functional analysis, I just want you to see this 6 circuits. A, B, C, D, right. Now, A, B, C, D, the first 4 circuits, they are used in adults, and E and F is used in pediatric. So, what is pediatric for circuit? Pediatric is less than 20 kg and less than 20 kg, less than 6 years of age, right? Now, why we cannot use the adult circuit in very small child? Well, definitely because their lung is immature and cannot tolerate high pressure and high resistance. In smaller children, we need a circuit with a minimal resistance and a minimal pressure, right? And this was what was done in E and F. In A, B, C, D, you can see there is an APL valve which offers resistance during expiration, and there is a bag which causes a lot of pressure generated in the circuit. So both were removed in E and F, and less resistance, less pressure generating circuit was designed in the form of E and F for pediatric, which we will talk about. Okay, so let us now talk about how we will discuss the circuit, how we classify them on for the functional analysis. Now, classification of the circuit for functional analysis is done in three groups. The first is your afferent reservoir system. Afferent reservoir system. Now, in this, the reservoir bag is present in the afferent limb of the circuit. Afferent limb means that limb which brings the inspiratory gas towards the patient, right? That is, if you see the diagram, this is the limb which is bringing the inspiratory gas from machine into the patient, and this has the bag attached to it. So this is afferent reservoir system. So A, B and C, they are afferent reservoir system. But if you see D, now this is the tubing which is bringing the inspiratory gas. This is the afferent tubing, and this is the tubing which is removing the expiratory gas, and bag is attached here. So this is the efferent limb. So this comes under the efferent reservoir system. So D, E and F, they come under efferent reservoir system. So afferent reservoir system, efferent reservoir system. Now, in afferent reservoir system, as I told you, is A, B and C, and in efferent is your D, E, F, and we have the combined system, some combined system like Humphrey ADE system, etc. Okay, so this is how we will discuss them. So let us start our discussion with the afferent reservoir system. Start with Mapleson A, the first Mapleson circuit. So this is Mapleson A circuit. This circuit was designed by Dr. Ivan, or Sir Ivan Magel rather, I should say. So this is also called Magel attachment or Magel circuit. So Magel circuit or Magel attachment. This is what is your Mapleson A. And this circuit was designed by Sir Ivan Magel in 1920, right? 1920. So what forms this circuit? What are the parts of this circuit? You can see there's a fresh gas flow inlet which is connected to a reservoir bag which is of 2-liter capacity, and this bag is either made up of rubber or neoprene, right? Then you can see this is the corrugated breathing hose. This minimum length of the corrugated breathing hose should be 110 centimeter, and the volume should be 550 ml. This is just little more than the normal tidal volume in an adult. Why? This is the interval volume between the bag and the patient end. This is so because this is little more than 500, because to prevent the expiratory gas to go into the reservoir bag. But it is possible if someone takes a deeper, let's say, expirate deeply and release more than that volume, which is always a possibility. So it is not that it is not a possibility that expiratory gas will not go into the reservoir bag. Okay, so it is just to prevent the expiratory gas to go into the reservoir bag. It was thought that the interval volume should be at least 550 ml. Then it has APL valve. This is a spring-laden valve, which is used to vent out the expiratory gas, and this is the patient's end. Okay, so this is Mapleson A circuit. Now this Mapleson A circuit This is the best circuit for spontaneously ventilating adult. This is most efficient circuit requiring least fresh gas flow for CO2 removal from this circuit, right, in a spontaneously ventilating adult. So what I'm trying to tell you that Mapleson A or the Magle circuit, this is most efficient circuit during spontaneous ventilation, right? So how it is most efficient during spontaneous ventilation, I will talk in a moment. And Mapleson A is among the Magle circuit is most inefficient during controlled ventilation, So this is not good for controlled ventilation. Okay. So we will analyze this circuit, that is Mapleson A circuit, for both spontaneous and controlled ventilation, right? We will analyze the Mapleson A circuit for both spontaneous and controlled ventilation. So let us first analyze it for spontaneous ventilation. Okay. So let us do the functional analysis of Mapleson A during spontaneous ventilation. So how do we use this circuit for spontaneous ventilation? Well, when the circuit is to be attached in a patient, it should be first filled with the fresh gas. Then only it should be attached to the patient. So let's say the circuit is filled with the fresh gas. This color is for fresh gas. So circuit is filled with fresh gas. Okay, it is filled with fresh gas. Bag is also filled with fresh gas. Okay. Now, during inspiration, this is the patient's end. This is the patient's end. Okay. And this is the anesthesia machine end. So during inspiration, patient take the fresh gas and the fresh gas moves from your machine, the fresh gas inlet, and also from this bag. It moves towards the patient. The circuit is filled with fresh gas. When this happens, this bag collapses. So this results in the collapse of the reservoir bag. So reservoir bag collapses because the gas is taken by the patient. The fresh gas is taken by the patient. Okay. This is happening during inspiration. Now patient goes into expiration. When the patient will expire, the expiratory gas will come out. Now expiratory gas, the first gas which comes out of the airway is your dead space gas. So first the dead space gas comes, okay, and then later on the alveolar gas will come. So dead space gas comes and it enters the breathing tubes, right? And from this side, the fresh gas is also coming. So whatever fresh gas is in the your breathing tubing, that is displaced by this expiratory gas, dead space gas, and the alveolar gas, right? That is displaced by this expiratory gases. And what happens? This fresh gas again go and fill the bag. Okay, so bag again gets expanded, gets filled with the fresh gas. So this bag gets filled with the fresh gas because the expiratory gas pushes the fresh gas which was in the tubing right back towards the inlet and the bag. So bag gets filled with fresh gas. Okay. Now further during the expiratory pause, what happens? More and more fresh gas enter the circuit. This bag is filled. A pressure is created in the circuit. Now this side is completely filled with fresh gas, right? So again the fresh gas pushes the expiratory gas, okay? Fresh gas pushes the expiratory gas and the expiratory valve opens, the alveolar gas and some amount of dead space gas also is removed into the atmosphere. Okay, and depending upon the flow of the fresh gas, again the fresh gas fills the corrugated tubing. Okay, so when the patient will take the next breath, again patient will get the fresh gas and some amount of the dead space gas, right? And dead space gas has the same composition as the fresh gas because O2 CO2 exchange is not happening from that. So this is how this circuit works in spontaneous ventilation. So if we keep the fresh gas flow equal to the alveolar ventilation of the patient, the efficiency of the circuit is best. If we keep the fresh gas flow equal to the alveolar ventilation, what will happen? That when the second breath patient will take some amount of dead space gas and the fresh gas. So efficiency of the circuit would be best. We want our patient to take the dead space gas, right? It is the alveolar gas which contains carbon dioxide. Got it? So remember that if we keep the fresh gas flow, in Mapleson A during spontaneous ventilation. If we keep the fresh gas flow in Mapleson A during spontaneous ventilation equal to the alveolar ventilation, right? The system is filled with fresh gas and dead space gas for next inspiration, and this is the way it will work most efficiently. Now if we keep the fresh gas flow less than alveolar ventilation, what will happen? If we keep the fresh gas flow less than alveolar ventilation, what will happen? That in the corrugated tubing, the alveolar gas, the expired alveolar gas would also be there. So rebreathing will happen. So what will happen? Rebreathing due to remain of small amount of alveolar gas, okay? And if we keep the fresh gas flow more than the alveolar ventilation, what will happen? Then the expired gas would have all the dead space gas, alveolar gas, dead space gas, and also fresh gas. So wasting of the fresh gas will happen. So all alveolar gas and dead space gas are vented out, and little fresh gas is also vented out. So efficiency will become less if you are keeping the fresh gas more than alveolar ventilation. But actually, if you see clinically such a good, let's say, how we have explained just now, we do not get such kind of thing in clinical scenario in a patient, right? Such efficiency is not possible to achieve in clinical scenario. Reason that mixing of the gases to some extent will happen because it is the same tubing which is having the inspiratory and expiratory gas. So there will be mixing to some extent, plus every expired gas volume would not be the same. Some expired gas volume is more than the normal, then definitely the mixing will happen, and the expired gas will go into the reservoir bag itself also. Plus the respiratory rate, it is also dependent on respiratory rate. If respiratory rate is very high and adequate expiratory pause is not there, right? Again, if there is no adequate expiratory pause, again there is the mixing, there's a chances of mixing, right? So in that case, if we don't have adequate expiratory pause, how we can remove the expiratory gases? By keeping the fresh gas flow little higher, towards little higher side. So it is normally above 70 to 90% of the alveolar ventilation, the fresh gas flow is recommended to be kept in Mapleson A circuit. As I told you that in practice, the number of factors dictate for a higher fresh gas flow, that is 70 to 90% higher. Because there are number of factors which dictate. I told you number one, there is a mixing, there is a possibility of mixing of various gas interface, then larger than expected tidal volume exhaled, and rapid respiratory rate, which will reduce the end expiratory pause, which is very important to remove the expiratory gases, which is very important to remove for the removal of expiratory gases, right? So if we don't have adequate expiratory pause, we need to keep the fresh gas flow higher. So normally, what is for most of the normal circumstances, what is kept not equal to alveolar ventilation but equal to minute ventilation. So fresh gas flow for spontaneous ventilation is recommended to be kept equal to the minute ventilation of the patient, Got my point? Okay, so this is the scene in spontaneous ventilation. This is the most efficient circuit for spontaneous ventilation, where we keep the fresh gas flow equal to the minute ventilation of the patient. All other circuit requires fresh gas flow higher than this minute ventilation to remove the carbon dioxide. A requires the least, that is equal to minute ventilation. Okay, now let us talk about how the A works in controlled ventilation. As I told, this is the worst circuit for controlled ventilation. Worst for controlled ventilation, right? This is the worst circuit for controlled ventilation. Now in this, fresh gas flow required for CO2 elimination, right, in controlled ventilation is very high, very high, and this also does not give us a guarantee that CO2 will be eliminated. How, we will discuss. So for controlled ventilation, see, for controlled ventilation, we need to keep the adjustable pressure limiting valve closed. Then only enough pressure will be generated for the positive pressure. So this end is machine end, this is the machine's end. Okay, the APL valve is kept closed, this is kept almost closed, so a sufficient pressure is generated. Now the circuit is filled with the fresh gas. The circuit is filled with fresh gas, and the bag is squeezed during the first inspiration. The anesthesiologist squeeze the bag, and when we squeeze the bag, the gas go with a positive pressure to the patient. So during first inspiration, all the inspiratory gas is the fresh gas. So all the inspiratory gas is the fresh gas. Now the patient goes into expiratory phase. So the expiratory gas would start coming into the circuit. The expiratory gas, patient will start exhaling the expiratory gas into the circuit, right? So this expiratory gas, bag is collapsed, valve is closed. This expirate, when the patient exhales, this would enter the corrugated hose, right? This would enter the corrugated hose, both the dead space and the alveolar gas, and will further pass behind into the breathing hose, and it may enter your reservoir bag from this side. Even the fresh gas is entering, right? And from this side, your dead space gas and the alveolar gas is also entering. It is also entering into the breathing tube. Okay, so whole mixing is happening in it. Now for next inspiration, when we press this bag again for the next inspiration, when we press this bag again, now in this bag there is the dead space gas, there is a alveolar gas also, there is mixing of whole over alveolar gas and the dead space gas, right? So when we squeeze this bag again for the next inspiration, what will happen? The first gas which will reach the patient would be the expired gas of the patient, right? Next gas would be the mixture of fresh and the dead space gas and the alveolar gas. So all the mixture will enter. Okay, so even if we, let's say, when we are squeezing the bag, enough pressure is not generated, so removal of the gas from the expiratory valve is not happening. But later in the expiratory phase, when enough pressure is generated, so expiration of the removal of the gas from the expiratory valve will happen, and the removal of gas will be mostly the fresh gas rather than your expiratory gas. So when we are squeezing for the next inspiration, what happens? Patient receives the alveolar gas, the expiratory gas, then the mixed gas, And as the expiration goes on happening, right, then pressure is generated, and what happens, the gas which is removed because of this high pressure, the valve opens, and the gas which is released in the atmosphere is the fresh gas. So utter wasting of the fresh gas is happening. Got my point in this circuit.